Mr. President.
Senator from Tennessee.
Well, first I want to congratulate Senator Casey and Senator Isakson for doing a terrific job of being excellent senators and coming up with legislation a few years ago that has helped children. We have now heard from the only two United States senators in the whole body so far who voted against this bill this year. We have 22 members on our Health Committee, Health, Education, Labor, and Pensions. We voted to extend this bill another few years because it's been so successful, and the vote was 20-2. And those two senators are very eloquent senators, and you just heard from them. They don't like Republicans, they don't like drug companies, they don't like billionaires, and they asked the question, well, is anybody listening? I'm listening. Who do we care about? Let's talk about these 7,800 children at Saint Jude's Hospital in Memphis. These are children who are very, very sick. Many of them will die prematurely. Every single one of them has free coverage at Saint Jude's Hospital thanks to the contributions of many, many people. Here's what the doctors at Saint Jude's Hospital say about the proposal that Senator Isakson and Senator Casey have made that's been in the law since 2012 and that received 20 votes in our committee against the 2 votes of the senators who are on the floor. They said, this is the St. Jude's doctors who are taking care of these very sick children. Priority review vouchers provide a powerful incentive. Does anybody care about these children in Memphis? Powerful incentive to stimulate drug development in rare pediatric diseases. These aren't some people in Washington in bureaucracies. These are doctors caring for dying children. These conditions, say the doctors, often lack the market opportunity to attract significant investments, or may present other significant development obstacles and costs that may deter investment from biopharmaceutical companies. Now, Mr. President, we may not like drug makers, but if we need new drugs for dying children, who's going to make the drugs if the drug makers don't make them? Some bureaucrat in Washington? Some committee member of the United States Senate? No. Someone who knows how to make drugs. And what this proposal, which has been on the books for 5 years, says is we'll provide an incentive to help these children. It has worked, and we voted 20-2 in our committee, which is about equally composed of Democrats and Republicans, in favor of extending it. So it's important for the American people to know that. According to the doctors at St. Jude's Hospital in Memphis, remember, they have 7,800 very sick children they're caring for today. We've witnessed strong evidence, they say, that the programs are working. The Isakson-Casey bill is working. Support for the voucher program is key to facilitating access to new agents, important to improving outcomes in pediatric cancers. So we considered this the way United States senators are supposed to. We brought it up in our committee. We debated it. We had amendments when they were offered, and we voted on it, and we voted to 20-2. The House of Representatives has also considered this legislation, Mr. President. It has enacted this. This would be part of our 21st Century Cures legislation, which we hope that the entire Congress will approve before we leave at the end of the year. But the bill expires at the end of this month, which is the reason for the extension. Every day we delay creates more uncertainty in the marketplace and makes it less likely that some drug maker is going to create a new rare drug to help these children. Now, we may not like drug makers, some of us. We may not like markets, some of us. We may not like Republicans, some of us. We may not like billionaires, some of us. But if the drug makers don't make the drugs to help these children, who will do it? Who will do it? And when we've got an entire committee that has worked through this, I think it is very unfortunate that we don't take the time to extend this for a period of time to create the kind of certainty we need. Now, on that 21st Century Cures legislation the senator from Massachusetts talked about, she's a diligent senator and a good member of the committee, apparently not paying much attention to the work we're doing on this bill. It's been my top priority. I've worked on it with Senator Patty Murray, the ranking Democrat, daily. I've worked with the president and with the vice president. We have a bill that the President of the United States would like for us to pass because it addresses personalized medicine, his top priority. This same bill addresses the cancer moonshot, the Vice President's top priority. The Speaker of the House of Representatives is turning somersaults to try to find a way for us to be able to find the money for that, as well as for opioids and other important projects that we would like to fund. And the Majority Leader of the United States Senate has said that if we're able to agree on this bill, it will be the most important bill we pass this year. Now, we're doing a pretty good job in our committee of getting to the point where we can actually turn into law something that the President, the Vice President, the Speaker of the House, and the Majority Leader would like to all see happen. And I thank Senator Casey and Senator Isakson for their help in doing this. And my hope is that we can work together, finish our work on this, and pass it shortly after we come back in November. Now, my last point, as far as doing nothing on funding, I don't know what budgets anybody's reading. Let's stop and talk about this a little bit. We talk about the Food and Drug Administration. According to Mercatus, in 2000, the FDA was funded at a little over $1 billion. In 2015, that number is $4 billion. We're about to go into a series of agreements next year, which we will have a chance to vote on, which will add billions of dollars of new funding to the FDA. In our 21st century legislation are provisions to allow the director of the FDA to recruit and hire more of the talented experts that he needs to hire, which means we need to pass that bipartisan legislation. And what about funding for research in the United States? According to the New England Journal of Medicine, the United States today, both through the government and through our pharmaceutical companies, spends nearly as much on biomedical research as all of Europe, all of Japan, and all of China combined. Now, let me say that again. According to the New England Journal of Medicine, the United States of America, publicly and privately, spends nearly as much on biomedical research as as all of Europe, all of Japan, and all of China combined. And in addition to that, Mr. President, I think the number is about $32 billion that we now spend through the National Institutes of Health, most of that on biomedical research at major universities mostly. Last year, and you know, I try not to spend my time talking about Democrats. I mean, I notice my friends on the other side, Republican, Republican, Republican. I get a little tired of that because we're working together here to get something done. But we do have a Republican majority, and it was under the Republican majority that we added $2 billion last year to the National Institutes of Health. Senator Blunt led that, but I want to give credit to Senator Murray, who was the ranking Democrat on that committee, because without Senator Murray and Senator Blunt, it wouldn't have happened. But give Senator Blunt credit for it. He happens to be a Republican, as long as we're being partisan about it. How much money is that? That's $20 billion over the next 10 years, in addition to what I just mentioned. And then this year, the same subcommittee, Senator Blunt of Missouri, Senator Murray of Washington, they added another $2 billion. Over the next 10 years, that's $20 billion more dollars. So we're up to $38 or $40 billion of new money for the National Institutes of Health over the next 10 years. And if anybody had been paying attention to anything I've said over the last 6 months, or any of the discussion I've been having with the President and the Vice President and the House of Representatives in our committee, we've been talking about $6, $7, $8 billion additional dollars for cancer moonshot, for precision medicine, for the brain initiative, for regenerative medicine, for a number of things that need to be done. This is the most exciting time in biomedical research that we can have. And what I just added up was 20 plus 18 plus 6 or 7. We're up in the mid-40s of new dollars for National Institutes of Health. And while it took bipartisan cooperation, Mr. President, let's say it, we do have a Republican majority in the United States Senate, and that is our agenda. That's what we want to do. We just don't talk about it in a partisan way because we usually get better cooperation and better results when we give credit to the other side, which I'm happy to do. So these speeches about maybe you don't like drug companies, then who's going to make the drugs? We're not talking about drug companies today. We're talking about 7,800 children who are very, very sick at Saint Jude's Hospital, receiving free care, and their doctors have told us that if we don't pass the Isakson-Casey legislation for several more years, we're going to make it less likely that they will live. Less likely that they will live. Now, that's what we're talking about. We can have a big debate about drug companies. We can raise taxes on billionaires. We can talk about Republicans and Democrats. Let's do that another day. Let's do that another day. Let's get back to business. Let's do our quiet work in a bipartisan way, which is the way we try to do it in our committee. And we have done it. We've had 45 hearings. 41 of them have been bipartisan hearings where we've agreed on the witnesses. We get more results than about anybody, but we don't get results by making speeches about each other and about making speeches about subjects which aren't the real subject of the day. The real subject of the day are 7,800 very sick children at Saint Jude's Hospital. Their doctors is telling us that if we don't provide more incentive to drug makers, continuing incentive that's already working, say these doctors, if we don't provide more incentive to drug makers to make the drugs for rare diseases that will keep them alive, that we aren't doing our job. So I thank Isakson and Casey. I hope by the end of the day we have accepted Senator Sanders' motion to extend the program until the end of the year. But what I really hope is that when we come back in November, that we will have an agreement, as we're perfectly capable of doing in our committee, that begins to move treatments and drugs through the FDA more rapidly so they can get into the medicine cabinets and the doctor's offices of this country at a lower cost and more quickly, and that we will have several billion more dollars of funding for the National Institutes of Health, that we will focus on the President's Precision Medicine Initiative with some of that money, on the Vice President's Cancer Moonshot with some of that money, on the Brain Initiative with some of that money, and that we will give each other a little bit of a pat on the back for this past year, raising $20 billion over the next 10 years for more money for NIH, and putting in the appropriations bill so far this year, another 20. So I look forward to the end of the day when hopefully Senator Sanders' motion will be adopted and the Isakson-Casey program, which has worked so successfully for these children, will be extended for long enough to create enough certainty in the marketplace so that drug makers will make rare drugs to help these children live. I thank the